My name is Daniel Molina. I'll be presenting my research titled Addressing Recruitment and Retention Gaps in Laryngeal Cancer Trials, a cross-sectional study. Laryngeal cancer, even though it's not the most prevalent cancer in the US, does place a significant burden on patients' quality of life. Things such as eating, speaking, drinking are all affected. And even though there have been a lot of advancements in medical techniques, survival rates these past few decades haven't improved that much. A big problem in laryngeal cancer research specifically is underrepresentation of diverse groups in clinical trials. They don't often reflect the broader population affected by laryngeal cancer, and this is because of barriers such as socioeconomics, healthcare access, and mistrust of medical institutions. But because of this, we need targeted recruitment and retention strategies aimed at these underrepresented populations in order to increase the applicability and effectiveness of these interventions that these studies are addressing. So we looked at examining the use and reporting of recruitment and retention strategies in these trials, focusing on historically underserved populations. To do this, we performed a cross-sectional analysis. We developed a search string and searched Medline and Embase and extracted data from the these the studies that we found on RAN from RAN. Um, when it was available, we extracted trial demographics and we also made note of any mention of limitations, challenges, or strategies regarding recruitment or retention. Uh, we also recorded characteristics of studies and their use of recruitment and retention strategies. Out of the 203 search results, we had 38 that actually met the inclusion criteria. So we removed 31 duplicates. We excluded 59 more based on their publication type, uh, study type, or if they used a non-English language. And then we further excluded another 75, also taking into account the EFI or Ethnic Fractionalization Index. We uh, use this to only include studies that had a diverse enough uh, that took place in a country with a diverse enough population to take into account these recruitment and retention strategies of diverse populations. But out of the 38 studies, none actually mentioned any recruitment or retention strategies designed to increase diversity. Um, in table two, we do see that three studies did include efforts to prevent patient dropout. Um, and this was via telephone calls, teletherapy, and home-based therapies. Two did address challenges and limitations regarding study recruitment. They similarly talked about travel and time constraints, but they didn't actually address any issues regarding diversity in regards to race, ethnicity, or gender. So our study did highlight significant gaps in recruitment and retention strategies within laryngeal cancer clinical trials and also shows the bigger issue of patient diversity in oncology research. So this shows a need for more consideration regarding a standardized reporting for these strategies and implementation. Um, so we hope that through comprehensive future research, inclusivity and effectiveness of laryngeal cancer clinical trials can be improved. This is necessary for increasing our understanding as well as the effectiveness and uh, helping these patients.